Hello, welcome to my office. As many of you know, I practice psychiatry. Many of you think that psychiatry is something that's not very difficult. Psychiatry is not what you think. Psychiatry has changed over the years. Psychiatrists don't wear white, and we don't have butterflies chasing butterflies. These are the images that you see on the internet. Psychiatry has many aspects, which I will show you. We study not only the brain software, but we also study the brain hardware. We both train in psychiatry and neurology. So we are trained to know everything about the brain. And I like the opportunity to give you a tour of my practice. And one of the most important things that you have to understand in a practice is first impressions. First impressions give you an incredible feeling of niceness. So we provide an office with beautiful colors and beautiful things. And as we tour, I'd like to tell you some things about psychiatry. Psychiatry, our job is to solve people's problems. People's problems are not just the simple things, but there are many things that you can have that makes you very sick. And as you can see, one of the things that we have available is technologies called transcranial magnetic stimulation, the ability to apply magnetic fields to the brain and change your mood. And when you walk to my office, you'll be encountering the reception area. And one of the things I need you to understand, one of the things that we do is the brain. The brain is a very complicated organ, this complicated. We have to learn all of this to help you. For those people that think that psychiatry has to do with schizophrenia, psychosis, one of the biggest challenges that we're now having in the United States, people are dying with fentanyl in all kinds of forms. Talk to any emergency room doctor, talk to any nurse in the hospitals. People are dying from fentanyl. So you're asking yourself, why do we have to die from this drug? Because many people begin to experience relief of something that they have underneath. People that suffer from a lot of anxiety, nervousness, and depression discover euphoria. That tells you that basically there's something underneath that makes you want to use drugs. And as we continue to understand this, you need to understand that mental illness and addictions is the result of something very simple. You can watch one of my YouTube videos, which we'll put the link on the bottom, as to what causes addiction. There is an answer to this problem. The basic answer is that people tend to self-medicate. They discovered the benefits of alcohol, and they discovered the benefits of the things that that can make them feel better, and that's how addictions are formed. So, what I want to tell you, psychiatry is not what you think. Psychiatry requires a lot of training, it requires a lot of preparation, and it deals with many problems that are very on the surface. And some of these problems, I can tell you for a fact, that when you go to the emergency room sometimes, and you have these heart pains, palpitations, and all that, and sometimes the doctor in the emergency room, you're fine. So why am I doing it in the emergency room? The problem is that you're dealing with symptoms that are causing, psychiatric symptoms that are causing physical problems. So as you can see, psychiatry is not as easy as you thought it was. And as I tour my office, I'd like to show you some things that we do here, okay? Come. One of the things that we do here is something called transcranial magnetic stimulation. As you can see, this is the newest technology in helping people. You will find a lot of this information in my YouTube channel and sometimes TikTok. Yes, we have a TikTok account where you can follow us and understand the things that we do. This is covered by insurance companies, and it does not require medication. It has an 85% success rate, and the most important thing, it is covered by insurance. So you see, psychiatry is not what you think. We repair the brain, the hardware, and the software. And these are the things you're going to encounter in my office, okay? And as here in this conference center, here's where we discuss patient issues, people who may not be satisfied. And one of the things I encourage you to do is basically tell us, for those patients who are mine and they come, are we doing a good job? Sometimes it is very difficult to see a lot of people, so we try to accommodate as many as we can in one day. And often because of phone calls, we might get behind, but we always try to complete what you came here for. I'd like to share a story with you But before I do that, I want to show you other things that we do. Now, one of the things that you're probably wondering, what is this device? Well, this device is not yet approved for any particular treatment, but psychiatry also has to do with mindfulness. And mindfulness means your ability to find ways to relax. We already know that people who meditate, people who find relaxing things, people who take journeys, the reason we take vacations is because we want to activate that part of your brain that generates alpha waves. These alpha waves, we already been proven, are the waves that calm you down. So what kind of waves that your brains generate? Well, we know that alpha waves is the relaxation. Beta waves is when you're active, and then delta waves when you have deep sleep. It's been shown, and I can show you many areas of textbooks about alpha waves and meditation. We know that meditation has a positive impact on health. This device is called AventMe. This device was designed by NASA, a NASA engineering, and it has three things, okay? It is a way to induce an alpha wave or a meditative state. It also generates pulse electric magnetic field energy. PEMF, which I will discuss in a separate video, is the energy that we go to the beach, the energy of the mountain. It is the energy, a particular frequency that the earth generates, and it's been shown that it helps. Now, one of the things that this device has, it also generates a particular sound frequency. We know that in entrainment, there are certain music, there are certain sounds that you listen to that relax you. This is why music therapy is very effective. But one of the things that this device has an entrainment frequency that puts you in a meditative state within 30 minutes. Meditation and relaxation has been shown to reduce blood pressure, improve mood, reduce anxiety. Unfortunately, these treatments are not yet paid by insurance companies, but they do provide incredible benefits on a long-term basis. And as you can hear, this particular sound frequency was developed by a NASA engineer. And these are the things you'll be experiencing when you come to my office, should you choose this option. But I like to end this video with a beautiful story. We're not just about fixing the brain, we're also psychiatry. It's a humanity. And I have intentionally put you in front of these pictures because this is the true story of a patient who I saw in my residency. It was a patient nobody wanted. It was a patient who attempted suicide 30 times. She was passed down to many psychiatrists and was given to me by my professor. He said, "You will learn a great deal from her." Now, we know in psychiatry that people that have multiple suicide attempts, they don't want to be seen, they don't want to be taken care of. But this is a very interesting story. It was a story of a woman in her 30s who would always wanted to die, and she would not divulge a lot of the information. And this is what she told me in this picture. And by the way, we have this on a separate video on YouTube and a link below so you can watch the whole details of this background. But this picture portrays a woman who said, "This is me. I feel fragmented. I'm dying. There's monsters everywhere. There's a monster underneath the bed. There's a monster up here trying to get into my bed. And when I looked at the picture, the monster is there. I am chased everywhere. Time is irrelevant. And I feel like a fish out of water of getting the worm." The symbolism of the fish out of water is a very helpless situation. If you've seen a fish flapping all over the place, right? That's what it feels like. And she was conveying her sexual abuse experience. One of the things that she did when she came to my office, she had tendency to scribble and write things. And I said, "What are you doing? I'd like you to go to a art history class or art picture." And she actually went. And she came one day with this picture and she said, "This is how I feel." She got so good at it, she continued to express her emotions to me. And she did another picture, as you can see here again in the video. And then, "This is me, the monster is inside of me. This is my soul going down the drain. This is the knife that I want to kill myself. And these are the hallucinations and I feel like I'm in prison." Her experience was that when she was a little girl at the age of 11, she was repeatedly sexually abused and used by the grandfather. You think this is not a common story? Think again, my friends. This is what I hear all the times in my practice. Early sexual abuse can cause significant impact. And we keep this like the skeletons of a closet. We all have skeletons in our closet. And when we keep our skeletons in the closet, we hide them, but the closet gets bigger and bigger and bigger. And when we open up, this thing falls on us. And what is that? Your fears, your shame. Remember, people who are sexually abused at a young age are very confused because all they know is about innocence and love. And they trust everybody. So now they have somebody who they love, a grandfather, a father, or an adult figure, and they entice them to touch things, their genitals, and it confuses their love for the rest of their life, especially when they're sexually abused repeatedly. They don't understand what love is anymore. Eventually they reach an age where they said, I had enough, and they start coming out. But the damage is left, takes years to fix. But I want to give you hope. For those who have been sexually abused, there are treatments that are highly effective, many of them, that can work for you. So it's not just about despair, it is about hope and not being ashamed of your skeletons in the closet. With this, I'd like to say goodbye for now. But I encourage you to see all the YouTube videos in which we will be presenting every week. You can watch us on TikTok. You can watch us on Facebook, on Instagram. I will be providing you, like I promised, information to give you hope and take the stigma of psychiatry away from your life. Thank you, and we'll see each other again.